I'm Kjirsten Ervi, and I am presenting on how to verbally de-escalate a violent mental health patient. We've all experienced that agitated patient who becomes violent and verbally abusive. But what is the first thing we usually do? Medicate, sedate, and chemically restrain. We give Haldol and Ativan like it's candy, but do we recognize the dangers behind these medications or even attempt to verbally de-escalate these patients? For patient safety and staff safety, it is necessary to discuss ways to successfully de-escalate a mental health patient without the use of physical or chemical restraints. Verbally de-escalating a mental health patient is a task in itself and requires skills learned through training and experience. The Joint Commission recommends mandatory training for all staff who could potentially be in the scenario of a violent patient or family member, as well as proper procedures and protocols in place. Requiring all staff to attend such training gives more opportunities for appropriate verbal de-escalation and the decreased use in chemical or physical restraints. There are 3 important steps for de-escalation: verbally engage, collaborative relationship, and verbally de-escalate. In order to even attempt to de-escalate a patient, you must get their attention and verbally engage with them, ensuring they are engaging with you as well. They could not feel safe to de-escalate unless you establish a relationship, find a common factor between the two of you. If they feel more comfortable with you and can relate to you, they are more likely to be successfully de-escalated. The final step is to actually de-escalate them. It is also important to provide physical space, use the appropriately trained staff, and use objective skills to assess agitation. It is very important to use a calm and soothing tone, positive and friendly attitude, express concern, offer food and drink, and allow a phone call to a spokesperson. Antipsychotics can have multiple side effects and complications such as sedation, neuromuscular effects, postural hypotension, cardiovascular and respiratory collapse, seizures, and occasionally mortality. When it comes to a violent patient, you are typically administering these medications without taking vitals or knowing much background or medical history. Any of these symptoms can occur at any time, and it is best to avoid any adverse effects. It is easier to not just use a chemical restraint and attempt to verbally de-escalate them. When it comes to physical restraints, some patients are extremely frail, and you can ultimately hurt them further by using restraints. All verbal de-escalation is the best choice when it comes to violent patients. In a study by Gascon, it was shown that healthcare workers show a significant risk of verbal and physical abuse. It was also discussed in the same study that healthcare workers experience burnout, and is partially related to violent episodes from patients in the workplace setting. Therefore, to prevent burnout in our healthcare professionals, it is important to educate them and provide them the resources to counteract violent episodes from patients to prevent this particular burnout from occurring. Overall, knowing how to verbally de-escalate our mental health patients who are becoming violent is an incredibly important part of our job. It is for both safety of us and our patients. We will be setting up classes to take on this topic in the next few weeks, and I expect to see all of you there. Thank you.